Okay, so now, okay, so sorry, for those, I see someone ask me, can you let you answer your question? I'm so sorry. Today we have a fantastic story to share. Okay, Rennie, can you unmute yourself, Rennie? Hello, Rennie. Can you unmute yourself? Is this Rennie the Rennie? Wait, let me see. Hello, Rennie. Can you unmute yourself?
Hello.
Hi. Okay, Rennie. First of all, I just want to have the perspective right. Do you speak English?
Yeah.
Okay
Not
lah.
good. Okay lah.
Okay lah, don't worry lah. Here, Malaysia, Singapore, we all campur one lah. And okay, so I think I will pass the time to you first.
Interview, right?
Oh yeah, okay, interview, correct, correct. Okay, so Rainy, how long have you been using the patches, and what makes you started using the patch?
11 months this month.
11 months already.
Yeah. Started using the patch because of my mom.
Because of your mother, and
Mm.
what happened to your mother?
She injured her lower back
Okay,
when she was playing basketball with my son. And she was 81 last year. And she
81 years old.
82
Okay,
this year, yeah.
okay, and how serious was the lower back pain?
Uh, I
It-
bring her to doctor and she actually couldn't sleep.
Okay,
And she complained it's very painful.
right,
So we bring her to doctor and doctor just give her medicine and then after that she's still not well. And then so
right,
happened my husband Kuje Daisy, which is my upline now.
yeah,
She just told me, she said, why not you try these patches? I was
yeah,
like, only one small little patches can heal my mom's back. She said, yeah, you just try lah. If cannot, then never mind, just throw it away. Then okay lah,
yeah.
give it a try lah. But my mom also agreed to patch. So after that, with that patch, I think two hours later, then my mom said, eh, 好似好啲喎, like that.
Wow, like getting better at the pain.
Yeah,
Okay,
getting better. So
yeah.
after that, Daisy said, why not you give it a try? So we bought a silver package.
Right,
And me and my mom tried together because I want to see how effective, how amazing the patches is. Yeah.
right. And during that time, did doctor ask your mother to go for any operation that time?
No.
No lah, huh? So it just a lower back pain, like just take medications only lah.
Yeah, she in pain for a few days. I think about 4 or 5 days.
I see, I see, I
She
see.
couldn't sleep at night and she really suffered. I can see she really not
Right,
easy
right,
for her
right.
because she's at her 81. So yeah.
I see. And then at what point of time that you realize, wow, this pet really doing magic? Apart from the pain reduce, are there any other improvement area of improvement that you say, wow, this pet really can do quite a number of things?
Yeah, I can
Uh,
show you I can share
Okay,
some photos of my
sure,
mom.
sure, sure. Wait, let me co-host you first.
Yeah.
Okay, can you can share already.
Already?
Yeah, can you? Yeah, okay, I can see already.
Wait,
Anyway, Rennie is a interior designer, right, or graphic designer?
graphic designer.
Graphic designer. So you see a lot of AI and Photoshop. Okay.
Okay. This was me.
What? This is after how many months?
This is I think 2 weeks ago. This one.
Oh walao, this
This
is
is last year April.
right.
Mm.
Last year April, so now it's about it's about 11 months.
Yeah, my husband took the photo and she told me that if I never see the comparison, I never know that you are aging.
Wow. They mean okay. Luckily you found a way to reverse it back. Wow.
Yeah. Luckily I met Kute. Share me the
Amazing.
patch. Yes.
Wow. Hey guys, if you look at, I think even her neckline also become no more neckline. You can see the some of the wrinkles around the eye disappear. The pigmentation also disappear on your left cheek, right?
Yeah, the pigmentation is lighter actually with the Alavida night cream.
Wow, wow,
Amazing.
wow, wow, wow. No more. And then you can see the what they call the laughing line used to be
Mm.
quite deep. Now the
Yes.
laughing line also disappear.
Yes.
Wow. Hey, if don't see you right now, I see last time, right? I can see it's 40, 50 plus years old. No? But now this one look like 30 plus years old. Hey, do you think that it's really like become 30 plus years old? If yes, type 555. If yes, type 555.
But can feel more energetic.
Right. For
Mm.
energetic also, and I think even looking at your mirror also make you energetic already lah.
Mm.
Wow, it's amazing. And apart from the look, right, in terms of your body, let's say your menstruation, your sleep, your hair, your nail, do you see any good changes?
Yeah, my menstruation actually, before that, my menses like 2, 3 days, then my flow is getting lesser.
I
But now
see.
after patching, right, my flow is actually prolonged to 5 days.
Oh,
Longer
wow.
actually.
Wow, wow. So, okay, guys, this is a sign of age reversal. That means as you start to see your menstruation blood volume getting less and less, right? It's normally people think that it's going to menopause. But now you see the volume get back more. It means that you are reversing already, you know. It's
Oh,
amazing. Apart from you and your husband, did anyone say that, wait, Rennie, how come you look so different? Like a very, very younger version of you already.
no, not really.
Not really,
Mm.
oh, they must be blind. Okay. So this is you. Do you see any similar? Wow. Okay. Let me see.
My mom,
Right.
you can see here on the beside, this is before and this is after. You can see her wrinkle actually lighter.
Wow.
And you see here this part,
The pigment. Oh yeah, yeah, yeah,
the cheek,
yeah.
yeah. And she also put on weight. It's very hard for her to put on weight.
Amazing.
And she also
Wow.
built muscle on her leg because
Okay.
my mom is very skinny. Before my dad passed away, she was only 38 or 39 kg.
Right. Right. 38 or 39 kg. Wow. That's
She's
really.
very, very thin. And now she is 41 or 42.
Oh, big. Oh, 3 kg is a lot for elderly. 3 kg is a lot
And
actually.
she has very good appetite now.
Wow. Amazing. Hey
She
guys,
eats less
do you
but more meal more often. Yeah.
guys, do you see the fine lines around the eye region? It's really 4 months later, you can see the reduction, and you can see the cheek, at beside the mouth there, right? It's sunken, it's sunken. They mean the collagen is lost,
Yeah, yeah.
lost, but now it's built back already, you know. Do you guys see these changes? If yes, you type 222. Hey, this is remarkable, you know. It means that there is a way for your body to build back collagen and your muscle by patch. A lot of people, if they get slimmer and slimmer, what most people do, they will drink more protein powder, ask them to put on supplement. At the end, it burden the liver even more. But now with the patch, you build muscle. It's counterintuitive. We think that you need to eat more protein in order to build muscle because you don't have the idea of organ function. But
But
with the patch,
for my mom, right,
yeah.
she don't really take supplements. Yeah.
Oh, okay. Even amazing. So you see, who say you must need supplement to build muscle, need protein? You just need the right organ function. Your body is able to digest the normal food. You can build like this already 81 years old, you know. I
Yeah,
think I think when your siblings look at your mother, are they surprised? Hey, how come
yes.
mama you surprised?
Yes, actually my brother and my sisters were like, wow, what happened to mama? What do you do to her? I said I give her
Wow.
the patch and then they are trying there. After seeing my mom, they like, wow, I must try lor. Please
Wow.
buy for me.
Amazing.
Get it for
And
me. Yeah.
if you see the left photos, 2024 March, right, you can see her neck is all like very string down, like very thin like this, like a turkey neck like this. You can now see on the right, you can start to see a little bit more firm already. Okay, you can start to see a bit more firm. This is
In
all
fact,
sign of,
her
yeah,
memory also better.
memory also better. Can
Mm.
you give me some example? Maybe last time she always forget things or she forget your name and now?
Not that not forgetting my name, but then certain things that she don't remember for many years. Suddenly she will ask me where is that thing?
Yeah.
Something like that.
Oh, so they mean something that she put SMS in the storeroom. She forgot a long time, never talk about this. But after
Yeah,
putting the pet, she start to recall they were dig inside the storeroom.
correct. Even she asked me about her old friend that already passed away.
Right.
She said, "Hey, I remember she passed away." Right? I said, "Yeah, she passed away many years ago." I said, "Why?" Oh, suddenly I remember she
Ah.
passed away. Something like that.
Wow, amazing. This means that cognitive function improve. When your cells start to build back the link between the brain cell, right? This is what happens. It means that what Rennie is saying right now, either the collagen is building, the muscle is building, it means the digestion is getting better, the memory is building, the brain cell connection is building up. These are all the inside changes that reflect on the outside. Amazing.
Yeah,
Wow,
this
amazing.
is, and then after 2 months of patching,
Yeah.
and this is what happened to her hand.
Okay.
Yeah. She all this while, I mean, in at her 60s, I remember she has this dermatitis. I mean,
Okay.
hand eczema because of
Eczema.
misuse of detergent.
Oh, okay.
So my dad,
Overuse of detergent.
no, allergy to a detergent.
Allergy detergent. Okay,
Mm.
okay.
So this is not the first time. I think at her 60, it's happened a few times, and the things doctor give her, I think doctor give her the what, steroid cream,
Right,
and then subsided. But
right,
after she patched for 2 months, right, it suddenly appeared with a blister, and she said it's very itchy, and she starts scratching.
right.
And then all this is only 2 weeks. Then I
I
tell her,
see.
Mommy, you have to tahan, okay? After you tahan this, I think this is a healing crisis. And then
Right.
I give her 1 bottle of night cream for 2 weeks. And then
Yeah.
you can see that after 2 weeks, her hand, until now, her skin is very smooth and very, very nice already. Very
Wow.
smooth.
Wow. And your mother wasn't afraid when you see this flare up?
She actually worried, and then my
Yeah.
sister also said, "Ayo, stop patching." Oh, I said, "No, you have to let him go through this healing crisis. I believe she will. I believe she will recover."
Wow. Luckily got this kind of doctor. You know, most people what they will do, they will bring them to hospital, go and check out, then the doctor will say something, get steroid cream and even more problems. You see,
Yeah,
it just take that 2 weeks of faith, right? About your body have the power to heal. Now no more this problem. I believe
yeah,
now
not
even
anymore.
yeah, even she go and cut vegetables, go and wash hand with detergent, now bo dai ji
No
already,
more.
right?
Yeah, both idea already.
Amazing, right, guys? This is how the self repair mechanism of our body. When you touch something, you get allergy, right? It means that the area got a lot of toxin. The body is not able to expel. So a little bit of agitation, it will start to flare up. So when you put the life wave, suddenly it got flare up. It's because you try to push up all the toxin have been accumulated there. When it's like you throw away all the rubbish in your dustbin, right? Now it become clean already. Sometimes even small rubbish throw inside, it will not fill up the dustbin. Now Gautima, 81, 82 years old, hand happy, can I believe now she can do housework, do cooking without worrying about the hand problems already.
Yeah, but the process is really itchy. She said very,
Yeah.
very, very itchy. Yeah.
I see, I see. So guys, if you are using for your mother, you have to know this is always a sacrifice. If you go to doctor, you take steroid, you feel better, but the sacrifice is the long-term health for your organ, kidney failure. You put patches, the not so good one is you get even more itchy, but the long term is always a plus for you. Amazing. Okay, continue.
This is my cousin.
Okay.
Yeah, he was admitted to ICU on
Right.
last year, 20th August.
Wait, last year,
Because
2024 August. Okay.
last year, 2024 August, because of heart attack during his badminton game in the evening at the court. And
Okay.
he collapsed, and then they rescued him with the AED emergency kit. But
I
he's still in
see.
coma, so they sent him to the Bukit Mertajam hospital.
Right. So
So
that
that
means
was day one.
when he got collapsed, it means that the heart stopped already. That's why they use
Yes,
AED lah.
yes,
Okay.
his heart
Is
stopped already.
is your is this your brother-in-law used to be a healthy person or all the while is actually quite weak already?
My cousin, he's 60, and all this while he's healthy.
All the
But
while is
he's a
healthy. Okay.
vegetarian.
Right, right, right. Oh, vegetarian. Okay, okay.
He played badminton twice a week.
I see, I see, I see, I see. Okay, okay. This is quite surprised. I think he himself also feel quite surprised. Suddenly get collapse. Who like eating
Yeah,
vegetarian is healthy, exercise twice a week is healthy, but boom, collapse.
yeah. Nobody know why. Then until the first day one he admitted, and then
Okay,
second day the family members are not allowed to visit
right.
him. So because of that, he suffer another again, the heart attack him at night on the second day.
Okay, okay.
Mm.
So after the first day, after the AED, actually it revived a little bit already, is it?
Yes.
Okay, revived a little bit already, but it's still very weak. But the day two, go another time, collapse second time.
Yeah, but
Okay,
he was in the hospital in ICU already.
okay, okay. There was in the ICU, collapse in the ICU. Okay, okay, understand.
And then the doctor advised to prepare for the worst because they concerned maybe another heart attack again.
I see. Okay.
So after that, then the nurse told my sister-in-law, so said maybe kena cuci darah.
Oh,
Cuci darah. Then she said, what's cuci darah? Then they said, oh, cuci darah is the dialysis. Then she asked why? Because my cousin, he was unable to urinate.
okay. Because cannot urinate. Okay.
Yes. The wife said he has no kidney problem. Why you want to
Mm,
see the kidney, the dialysis? Then
yeah.
the nurse said, explained that they have followed the SOP guideline. So
Mm.
if they cannot urine, then they have to cuci darah already.
Need to do dialysis already. Okay.
Have to put him on dialysis. So we actually stop tell the sister because we're in KL, she is
Yeah.
in Batajam. So
Right.
we asked her to stop, don't do this. Because what happened to my father, same case, my father admitted and then
Yeah.
they dialysis him because my father is healthy. He just
Right.
got a bacterial infection. Then they send him to hospital. Then after they dialysis him, and then my father, yeah, just like that,
Just
passed
passed
away
away already.
in 4 days.
Wow. So that means your father used to be okay, okay. What was the
Very
reason?
healthy
Very healthy. Okay. What is the reason he need to go to hospital in the first place?
because he
Okay.
cut his finger, and then I think he got infected.
Yeah.
Then we did not bring him to hospital because normally you cut a finger, you just put plaster, you put
Yeah.
the alcohol swab, then you
Yeah.
just put
Yeah.
plaster, right?
Iodine.
But
Yes.
then this time he is serious. I was not in KL, I was in Penang that time for classes, and then my sister brought him to Sedang Hospital.
Yeah.
And then when he admitted, that time he's still okay. I still FaceTime with him. Then he said, "Oh yeah, I'm fine. You just focus on your study."
Us.
Then after that, at night, then my sister called me already. You have to come back because Papa is in emergency because they dialysis him because he cannot urinate.
I see.
So I remember this. So I tell my we in the group chat. Then we said no, we don't give Koko this cuci darah. Don't allow. Have to put it on hold because you don't sign. They cannot do anything.
Right.
Mm.
Wow, amazing. So they mean you are saying that your father used to be okay before you go is okay, and then just because a cut, maybe she doesn't feel right, and then she go to hospital. The doctor start to see very serious thing, and then
Mm.
realize that she cannot. Maybe because of the medication that she couldn't really urine, and then the doctor said according to the SOP, I don't care whether you kidney good or not, but according to SOP, no urine, need dialysis. Then he just poke and then got
Yeah.
dialysis. And very
Mm.
likely because of this, caused the bacterial infection and then just pass away like this.
Yep.
My goodness, man. But
So
this is
same.
something I worry when you guys talk to me about when to poke on the lung, poke on the hole, poke on the trachea, poke on the kidney. Right? The moment you poke, right, you see your kidney already weak already. You still want to poke. You are making the matter worse only. Okay, you saying something, Rennie?
No. Just continue.
Okay, okay. I think, but you see, I think Rennie, when did your father pass away?
Last 2 years ago.
2 years ago. Okay. Wow, amazing. And thank you for sharing it to us. Hey guys, I think this is something very emotional for Rennie. But Rennie is bringing this out and to really tell you guys, right? When you couldn't urine, the doctor asked you to do dialysis, right? Think carefully because doctor only follow the SOP set by the other doctor without really understanding your particular cases. Do you think it's scary or not? The doctor can just don't look at you, look at the SOP, look at the paper. I want to poke you, means I want to poke you. And if something happened to you, it's your bacterial infection, not my medical negligence. Do you think it's scary? If you think it's scary, type 333. If you think it's scary, type 333. Your kidney is perfectly fine, you are okay, nothing wrong, but because you cannot urine, follow the SOP. go dialysis.
But
Crazy,
my
right?
intention to share this is because I think even in emergency, it's
Right.
essential to consult the doctor carefully and
Yeah.
confirm whether any additional measure are necessary before they proceeding or
Right.
considering any alternative option, because
Right.
the person in on the hospital bed is depending on your decision to save their life. So
Right.
yeah, actually very, very important for you
I
to make
see.
decision.
I see. I see.
So
Yeah.
for my
This one.
cousin, we only managed to send in the patches on day 3. With
Right.
only 5 patches that the other cousin in Serdang, Kedah, that she only have the last 5 pieces of X39.
Right.
But then the nurse, because in ICU, in government hospital, right, ICU, you cannot go in like sesuka hati, right?
Yeah. Yeah.
So she actually secretly go in and put the 5 patches X39 on my cousin's hand with the religious book cover it.
This is the day one.
No, day 3.
Day three is they means after the two collapse already lah.
Yeah.
Okay. Okay. Okay.
Yeah, after the day 3. And then we thought of one of our brand partner also staying nearby Bukit Mertajam, Fiona.
Yeah. Yeah.
So I call her. Then she said, "Oh yeah. She has X39 EE. Then she also bring the beta. She said, bring beta to hospital. Let the doctor read the licensing and all the pattern. Okay. Then because of her, then she brought that along, and then let the doctor go through. But the doctor
Yeah.
did not scan through the beta. It's my
Right.
sister-in-law insisted, and she went and print out everything and actually forcing the doctor to go through.
Right. Right. Wow. Wow.
So on
Wow.
the day 3 at night, right, still cannot go
Yeah.
in. Then my sister-in-law actually secretly go in and patch the EE on my cousin's feet. EE.
Okay.
And then
Thingy
a
one.
few pieces of X39 on his pillow,
Yeah.
secretly.
Okay.
Mm.
Secretly. Okay. Okay.
So day 4, I call Linda because I don't know what to do. So Linda advised. She actually guide us what to do, how to patch with this protocol. So
Right.
Linda helps a lot.
Right. Okay. Let me. Okay. So that means that you were in KL, but there was a brand partners in nearby the Penang.
Yeah.
Okay, and then you ask her to help out, and then she borrow you the patches and the brochure to the doctor.
Yeah, she drive all the way from Kulim to Bukit Mertajam Hospital to bring
Wow.
the patches.
Do you know Fiona before this?
Yeah, I met her once. I
Once
met
only
her
lah.
twice only, yeah.
So they mean is your cross line lah, is your sideline. You don't really know her lah. Nah.
Not really know her. Sideline lah, sideline.
Amazing, amazing ah. Okay, continue.
Yeah. Then just like that, Linda actually helped with the patches and also teaches the protocol how to patch lah.
Right.
Because my sister-in-law, my sister-in-law, she very kanchiong, right?
Yeah.
She actually accidentally on day 4, she actually patched my cousin brother the whole pack of X39.
30 pieces of X39. Okay.
Because Linda said every 6 hours she have to change 5 pieces here, there, and here. Then
Yeah.
she also kanchiong like kelam
Yeah.
kabut. Then she said, okay lah, I just patch everything lah. She just put everything. Then she called me. I already finished X39. I need to get a new one. I said, huh? You just got the whole part. Yes, last night, and then you told me no more already. It's very expensive. I said,
Okay.
how? Then never mind. I call Linda again. To lend me the new patches from Linda. So Linda
Right.
lala move lah all the way from Penang to Bukit Mertajam.
Right.
Yeah. So
So they
because
means the
I think because of
yeah
the X39, right? She
yeah
patches actually the
30
whole 30
okay
pieces, right?
yeah.
On day 5, my cousin actually awake.
Wow. So that means like maybe he accidentally did the right thing lah.
Yeah, lah.
Wow.
Because I remember Linda told me that one Japanese also did the same, right?
Yeah.
Yeah,
Japanese do the same thing. 30
yeah.
pieces all put at tissue paper, handkerchief and put on the body.
The handkerchief. Linda also asked us to find like handkerchief. You go find
Yeah.
handkerchief. No handkerchief. I said hospital don't have. then 青菜 put stick on the just
Wow.
after the
Okay.
doctor reviewing the beta 2, right? After my
Yeah.
sister came out, doctor said, okay, if you insisted, right? So we family decision. So anything happen, the hospital will not take responsibility.
Right.
Mm.
I
Because
see.
he need to wake up to do further scanning, something like that.
Yeah.
Because the hospital only have one doctor that can
Right.
deal with that. So they try to transfer him to the Penang hospital, the
Right.
modern hospital. With
Right.
this process, took him, I think, 1 week plus for him to transfer from
Okay.
PM to Penang.
Okay. Okay. Okay.
Yeah. Then the doctor will say, oh, if you transfer on the way to Penang, anything happen, then you have to, the family member have to bear the responsibility. The
Responsibility.
doctor
Okay.
will not take any risk.
Right. 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 And,
So
but
I said, never mind, we have X39. We just put X39 in ambulance all the way to Penang.
I see. So you have the patches in the ambulance also.
Yeah, yeah.
I see. I see. So during that times, right? Does your brother-in-law or cousin able
Cousin.
to pee already? Able to pee already?
Yeah, yeah.
Wow, luckily never
Actually,
poke ah.
on third
Yeah.
day, yeah, third day already, the nurse told her, oh, tak payah cuci darah sebab dia sudah boleh kencing.
Wow, just that few hours ah.
At a few hours.
Wow, sai man. Luckily, man. Wow, really. Luckily you insist, you know. If not, maybe now she's
But
still in the
to be
hospital.
honest, we also not sure if this would work,
Yeah,
Just 黏罢了啦, we say.
yeah, yeah. Yeah, we just have to
Yeah,
stick. Wow.
because it's emergency. Because we said because my cousin is my father's godson. I said we cannot save Papa, so we have to save him.
I see, I see, I see, I see. Oh, so you and this cousin has no bloodline one. Bloodline is
It's
your first.
my 阿姨 son.
Oh, okay, okay. So it's your cousin. Yeah, it's a bloodline, same bloodline. Okay, okay. And then okay, now you from Bukit Mendajan, right, to Penang, and then
Penang.
okay already. After go back to Penang with the patch, all get healthy
Yeah,
already.
after go back to Penang, then doctor say, oh, then he need to do the bypass. Can see
Oh,
here.
for okay,
Yeah.
okay,
Mm.
okay. And then he did the bypass lah.
Yeah, he did the bypass. Then
Oh,
this is
oh,
after
okay. I
the
see.
bypass. Then this
I
is what
see.
Linda taught how to patch after the
Yeah.
surgery
Right.
and like that.
I see. Ah, this is definitely a bypass.
Mm.
I
Well,
see.
I think life wave, yeah, it's life wave lah, save his life.
And how old is he ma?
60.
60 only ah.
Mm.
And
He's healthy, yeah.
wow. And how is him right now? Is he still in the hospital, rehab,
Back to work
or
already.
oh, like normal person already?
A non-person, he's going to
Badminton again.
no, not badminton. He's going to travel next month.
Where?
I can't remember the name.
No,
Xizang,
my
Tibet.
goodness. Oh my goodness. Just go a bypass, go Xizang ah. Walao eh. Ayo, this one you have to let him know, Xizang oxygen very low ah. Your heart cannot take it, especially your heart has already got bypass. Oh.
Yeah, already told the sister.
Sometimes I do not want to help or not. Help you, you still want to go back to the problems, But okay, but anyway, this cousin say thanks to you. I thank Rennie. Luckily you guys helped my life.
But our ultimate goal is make sure he awake from the
Yeah,
coma.
yes.
So we did it lah actually.
Yeah, yeah, yeah. And did he reflect on the process and then like appreciate you, his wife or something?
No.
Or no just like this is
Uh,
like I'm entitled to be helped. So sometimes this is what I feel always, if no matter how many times God want to save you, right? If you still can't reflect, how many Rainy are there, right? How many Rainy are there? How many chance Rainy can help? So even you have a good cousin can help you one time, actually two times, right? Because collapse two times and got one bypass to recover. Multiple time you being helped. You still want to go to Xizang.
But we still see him in WhatsApp. He's still
Yeah.
texting every morning, greeting everyone, good morning.
Ayo, okay lah. I think anyway for his case, I really hope can don't go to Xizang. Xizang is very thin air, you know. Its oxygen is low, and the reason people got heart attack is because the oxygen is low. So your body suddenly cannot take it and then got heart attack. And now he still want to go for Xizang, high altitude, air is cold, is thin.
He recover, yeah.
My goodness, but yeah. Anyway, let's see what is the thing that is waiting for him. And
But I'm grateful for the support from my brand partner across the state. Yeah.
wow, I think it's
Uh,
definitely I think it's 全员出
teamwork
动啊
teamwork
teamwork.
is very important. Yeah.
Oh my god, got pergi
Without
Madang, got the
Linda,
Penang, got the
without
KL.
Fiona, yeah.
Amazing, amazing. And the good thing is, I think you also quite garang lah. If you are someone only a cousin, like you want you talk to the wife, say don't go and poke. Wow, this one is take a lot of courage, you know. I think luckily you have the kind of firmness. This is why I think the sister-in-law also okay. If you a little bit soft, I
Because
think
all
she'll poke
cousin
one.
is in the group chat. We were discussing about this because the wife don't know what to do because she's alone.
Right, I
Husband
see,
is
I
in the
see.
hospital. Yeah, she with like helpless lah. So she asked in the group chat, what should she do?
I
Please
see,
help
I
me.
see.
Yeah.
I see. And how
Then
many
so
sons?
happen we have live wave. Because of this, my
Really?
other cousin also started using live wave.
Yeah, I think this is a wake up call. And how many children your cousin have?
One.
One. And how
Mm.
is he or she?
21. He's 21.
Luckily, you not just save your cousin, you save someone father.
Yeah.
Amazing, amazing. Luckily, you really have the kind of, we really respect this. So since I already lost my father, I cannot let other people to lose their father. This is crazy, amazing things. Okay, Rennie, is there anything else you want to add on?
No.
Okay,
Still the
so
same answers. When you are in emergency, you really, really, really have to consult the
no
doctor
choice.
carefully. Yeah.
Yeah, consult the doctor
No joke.
carefully and just remember nowadays the doctor also don't know they can think carefully or not. So ultimately it's still based on your own judgment. Imagine this if Rennie didn't stop the poking of the dialysis, right? Just few hours later only, it's a world of difference. It can become a dialysis patient for life. Even he wake up. We thinking, what if he never wake up after the dialysis? But now because of that one sentence, he now can go 西藏 already. My
And
goodness.
go Tibet.
Oh, can go Tibet already. Crazy. Right? Hey, do you think that this is what we mentioned? The information you have the patch already, but you need the brain, you need the education, you need the lesson. And just now, at the nick of time, Rainy provide the lesson from the experience to the patients, or else it's going to be a world of difference. Crazy, yeah. Okay, thank you so much, Rainy. Thank you so much. Thank you. Hey, can you
Oh,
guys help me to say thank you to Rainy or not? Thanks, Rainy. Thanks, Rainy. Rainy, you're saying something?
I know. Oh,
Okay,
oh.
thank you so much. Thank you, Rainy.
Okay.
Okay, so I'm going to do a summary for you guys. So just I really don't want you guys to take this lightly. What Rainy are sharing just now is this. Um, of course, the mother gets so much of result. She got so much of result. But at the nick of time, in a situation like this, right? Normally, we only can learn by experience, learn from the pain. But actually, don't need to. We have someone suffer from this. You just have to step up to share your information. This is why people like Rennie willing to step up to share that don't go and poke. And luckily, and the good thing happened. The patient got collapsed. Collapse means the heart stop. Do the LED, recover a little bit, but go to second collapse. The heart stop again. They mean two-time collapse already. In the doctor eye, right, it's very less hope you are going to revive again already because the heart get trauma consequently, right? So what we do, only put the patch, let him to hold the patch, is able to see some result already. Just a few hours later, can start to pee already. So luckily with the patch, with the rainy advice, able to pass through to avoid the risk of bacterial infection because of the poking for the dialysis. And then we continue to put more. In a very need of times, right? This is what we can do. you use the CRP, the energy enhancer, day 1 to day 5, or you put the 5 pair at one go. And really, really dire condition, you can always put 30 pieces. You don't need to ask where is the exact location. You patch whenever there is space. Okay, you just put whatever agar paste. Everyone, you will have your own 6 cents one. Okay, you distribute the 30 pieces of X39 around, most common acupuncture point. Even you have no idea, it's okay. Just patch around anyway. The next day, just wake up miraculously already. Do you think that in this time where the doctor say you have no hope, you have heart attack collapse for 2 times in the world, there is a stickers like this, 30 pieces less than about 500 ringgit is able to save one life, to save a father with only the 500 ringgit? Do you think that this is very, very magical gift from another planet? You think it's really magical gift, you know? Think about this in terms of the price. Energy enhancer maybe 200-300, maybe S9 500. We say 800, right? Okay, 800 ringgit for this 1 to 2 days time can save a life. Do you think it's magic? If you think it's magic, you die 555. Do you think it's magic, you die 555? It's crazy, right? My goodness. So we are going to continue to give this kind of educations. So we have the patch already. We know it's definitely is working. Now is how we can add on with more education for you guys so that you can empower yourself with confidence to guide the people around you where they are still unconscious. When I say unconscious means they are so unaware about what is going on. Imagine this. You are vegetarian, you are working, exercise very healthily in healthy lifestyle, and yet you got collapsed for 2 times. It means that there is a sign before that is telling you maybe you have to take certain supplements to supplement your vegetarian diet, but maybe you don't care. You think that, no, it's okay, I can ride you through, I still can play badminton, I'm healthy. But when the thing happen like this, you know something is not right. When you have a chance to recover again, you want to go back there again. So this is what I mean. If we can have more education, more elevate more clarity and consciousness, right? This is what Life Changer is able to do. Okay, Lifeway patches from David Smith. We can do the education. Anyone is in to help Lifeway to do this. They have the best product. Let's offer the best education and experience sharing. Anyone is in for this? If yes, type 555. Anyone is in for this? Patch is there. You need someone to educate. You need someone to share the information. You need someone to make this thing become a norm about healing crisis. Imagine that when you put the pad, you're very itchy. Rennie's sister will say, oh, go to doctor, take injection. But Rennie said, no. I think it's healing crisis. So now, potaiji already becomes so much better. This is what it takes. Just a patch and a few lessons, we are going to take charge of our life already.